Hi there, I'm Claudia Friedlander, and you just clicked on a video that talks about tongue tension. So I suspect you're either a singer who's grappling with some tongue tension or a voice teacher who has students who are grappling with tongue tension. Well, the good news is that this very common problem has a solution. Like most other vocal technical issues, tongue tension is the result of movement patterns, and movement patterns can be changed so long as you go about it systematically and mindfully. When singers talk about tongue tension, what they're usually referring to is a movement that depresses and retracts the base of the tongue. Let's take a quick look at the anatomy involved. The extrinsic muscles of the tongue include the styloglossus, paladoglossus, genioglossus, and hyoglossus. The muscles that are of greatest interest to singers are the genioglossus, which you use to stick out or protrude your tongue, and the hyoglossus, which retracts and depresses the tongue. The genioglossus protrudes the tongue. It helps to create the variously arched tongue positions we use to form vowels. The hyoglossus retracts and depresses the tongue. And when we're talking about tongue tension, as I mentioned, we're usually talking about the hyoglossus. This muscle originates in the hyoid bone, from which the entire larynx is suspended. So when the hyoglossus retracts the tongue, it exerts a downward pressure on the hyoid bone and by extension the larynx itself. This can create significant resistance for vocal production, making singing more effortful and also potentially limiting your range, resonance, and registration options. Here's a procedure you can use to assess for tongue tension. I'd like you to take your thumb and then just gently press and massage the underside of your chin way back close to where your throat is. And when that area feels nice and soft, I would like you to slowly open your jaw like this. And now just go ahead and do that again. Massage so that it's soft and then open your jaw. And you're monitoring for any movement that you feel in the area of your thumb. Does the area stay soft and pliable, or do you feel something pushing down against your thumb when you open your jaw? Next, I'd like you to just practice inhaling and exhaling through your mouth while you're continuing to monitor the underside of your jaw, just this area right here. So I'm just going to breathe in and out a few times and notice if I feel any movement there. Next, I'd like you to silently form the shape that would be your vowel sound ah. So you're just going to think ah, you're going to arrange everything in the shape of an ah, but don't actually sing or say ah. And lastly, now I'd like you to actually sing onset on ah. Ah, ah. Again, noticing whether that area under your chin remains soft and pliable or whether you feel any movement there. If you don't feel any movement there, that's good news. It means that you probably don't have much in the way of tongue tension related to these movements that we're looking at. However, if you feel a downward pressure against your thumb, that's your tongue retracting and depressing. And that's what we're talking about when we're referring to tongue tension. So we're going to go through this process again because it's important to find out what is making your tongue retract. Some people only retract the tongue when they go to sing, but I've had students who just when they're walking around breathing, they feel like they have to pull the tongue back and down just in order to inhale. So let's go through the sequence again and notice if your tongue is moving down, when does it move down? So first, just opening the jaw. Can you keep your tongue relaxed while you open your jaw, or does it go with your jaw? And then breathe in and out. And then think an ah vowel. And then onset on ah. Ah, ah. And just keep track of the sensations and movements that you notice while you're doing all of these things. So now I'd like you to make some further observations and see if you've got a little more control over what your tongue is doing. What we need to do first is decouple this tongue movement from the other movements that we're making. When does your tongue retract? If it's retracting when you open your jaw, can you teach yourself to open your jaw without the tongue retracting? So just repeatedly open the jaw. Oh, my tongue retracted, can I relax? Now my jaw's open with my tongue relaxed. I'm going to close my jaw. Can I open my jaw without retracting the tongue? And you will probably find that with some practice, you can open your jaw without also stiffening the tongue. If you're used to doing this when you sing, when you like prep to start a phrase, it's going to take some slow paying attention, noticing where is it moving, when is it moving. But my guess is that you open and close your jaw all day long, and probably the only time that you also retract your tongue when you open your jaw is when you're prepping to sing. So you need to decouple that movement. Okay, next thing, you're just going to see if you can inhale and exhale through your mouth while keeping your tongue relaxed. And if you notice that when you inhale, the tongue goes down, see if you can slowly inhale while allowing it to stay relaxed. Again, that might be a tricky coordination for you, and it might spasm a little bit because that tongue might think that it really needs to help you inhale, but in fact it doesn't. And once your tongue learns that it doesn't have to make that movement when you inhale, it's probably going to stop doing it because, you know, our lizard brains are lazy. We don't want to have to work any harder than is absolutely necessary. So if I don't have to contract a muscle, I'm not going to once I find out that I don't have to. Okay, so now think ah. It probably doesn't look like I'm doing anything, and it might not feel like you're doing anything either, but you'd be surprised. A lot of people, when they first think the vowel sound that they're going to sing, then just reflexively the tongue goes down. So see if you can just think ah, think a shape of ah, and let that stay relaxed. Do this one step at a time. Don't try onsetting and singing until you can get to the point where you think ah. So you can open your jaw, you can take a breath, you can think ah, and the tongue still stays soft. Then see if you can onset on that ah. Ah. And if your tongue doesn't retract until you onset on ah, that's progress. Okay? Get to the point where you have some control over what your tongue is doing. Then you may find that it's just reflexively engaging because you're starting to sing. We can work with that too, but it's going to be much easier to work with it if you can decouple that tongue movement with jaw, breathing, thinking the vowel first. Now I'm going to go over a 4-step process for alleviating tongue tension. The technique here is based on a technique that fitness professionals use for corrective exercise routines that they use to help athletes improve the strength, flexibility, and coordination of muscle groups. Step 1 is to release the muscle. Step 2, stretch it. Step 3, you want to activate the muscle now that it has been released and stretched. And then the 4th step is to integrate it into the movement pattern that you're actually going to be using that muscle for. The first step is to release the muscle. Techniques for release include massage. You can have somebody else massage you, or you can use an electric massager. You can also, for larger muscle groups, use a foam roller or a golf ball, but we're not going to use anything that big or aggressive because the tongue is very tiny. It's right there. So I have a small massager, and what I'm going to do is crank it up, and then I'm going to point it at the back of my chin, right where the base of my tongue is. And then while I'm getting a good massage there, I'm going to open my jaw, and I'm going to slowly and repeatedly protrude and retract my tongue like this. When using external massage to release a muscle, it's most advantageous to just leave the massager in one place and then move the muscle around. That's why I'm just keeping this in one place and moving my tongue back and forth. It might feel good to move the massager around. You can go ahead and do that, but you're going to more effectively release the muscle if you move the muscle and leave the massager in place. In this position, also take care not to jet your head forward while you're doing this. Sit with good alignment and then bring the massager to you. The next step is to stretch the muscle, and I've got a gauze pad here. I'm going to use this to grasp my tongue and give it a bit of a static stretch. So I'm going to hold onto my tongue. First, I'm going to protrude my tongue. I'm not just going to yank on it. And then once I'm sticking my tongue all the way out, I'm just going to exert a gentle stretch, continuing to move the tongue in that direction. So when performing a static stretch of any kind, you want to hold the stretch for at least 30 seconds so that you give the muscle fibers an opportunity to release. Now I'm going to activate the tongue muscles used in articulation in isolation. So there's going to be a little bit of vocalizing, but mostly I'm just going to see if I can onset on ah without retracting my tongue, or just without retracting it as much as I otherwise might. I'm going to place a pencil underneath my tongue, and then I'm going to hold it in place by pressing the tip of my tongue against the back of my lower front teeth, like this. Once the tongue's in that position, I need to keep my genioglossus active. That's the muscle that protrudes the tongue. It's also the agonist to the hyoglossus, so if I try to yank the tongue back, I'm not going to have as easy of a time because the genioglossus is engaged, assuming that I can keep it engaged. And also in this position, I'm giving my hyoglossus a little bit of a stretch. So let's see if I can do this. Ah, ah, ah. You may find that as soon as you start going ah, your tongue retracts, the pencil goes flying across the room. That means you should just take a step back and do a little bit more release and stretch, and then see if you can onset on ah while the pencil stays in place. And then the remaining step is just to integrate that new movement pattern with actual singing. So if I can still onset on ah without retracting my tongue. I'm just going to gently monitor here and see if I can go. Oh mio papino caro. And my tongue is staying nice and soft. Now, the only reason that my tongue is staying nice and soft is that I've been working on this for a really long time. Keep in mind that the tongue does not release all at once. It can take a lot of practice, same as if you can't touch your toes and you want to be able to touch your toes, you're not going to be able to just stretch for 2 hours and then touch your toes. You're going to have to come back to it day after day. You're going to be able to go a little bit farther, and then your hamstrings will get a little bit looser, and eventually you're going to improve your range of motion, maybe be able to touch your toes. I have yet to meet a singer who comes to my studio with more tongue tension than I had myself when I first started working with these techniques. So I know if I can release it, anybody can. But it does take patience, it takes repetition, and you got to be in it for the long haul. The good news, again, is that to whatever extent you can alleviate your tongue tension, there's going to be immediate payoff for your ease of vocal production and for your singing, even if it doesn't come all at once. The more difficult news is that if you've been relying on tongue tension to define your vowels, create resonance, or stabilize your larynx, these are among the reasons that we generate this tongue tension, then once you alleviate the tongue tension, it's going to destabilize your technique temporarily because you're going to have to find another way to define a good ah, or whatever vowel you're retracting your tongue on. You're going to have to find another way to create that internal resonating space, and you're going to have to find a way to stabilize your larynx without retracting your tongue. If you see a singer singing and their jaw is shaking in tandem with the vibrato, it's not jaw tension, it's usually tongue tension, but it manifests as jaw movement because the tongue and the jaw are attached. If that's happening, then chances are that singer is using that tongue retraction to stabilize their laryngeal position and then push against it to produce their sound. And they might be making an amazing sound. And then if they let go of the tongue tension, they're going to feel like they can't sing at all. But there is a much better way to stabilize your laryngeal position, and there are other ways to create your resonance, and all of them are going to be much easier, less effortful, and more beautiful once you get the hang of this. So stick with it. Most singers, when they begin learning technique, bring some degree of tongue tension to the studio. Habitual speech habits have us retracting the tongue just to articulate ah and other related vowels. My first voice teacher taught me to retract my tongue because it got me to make this big woofy resonant sound that made me think I was a dramatic mezzo. I'm not. And I had to let go of that in order to find my true voice and be able to sing with the degree of ease that I now enjoy. So it is a movement pattern. Singing is movement. All of these things that we do to learn how to sing are just training movement patterns. Movement patterns can be learned and replaced. And so I encourage you to explore ways to release your tongue. You're going to be so glad that you did. Even if it takes a little while, you're going to find out that you have resonance and registration and timbre possibilities that you never imagined possible. And singing is also going to get a whole lot easier.
Aus alten Märchen winkt es hervor mit weißer Hand.